Hello, good evening. My name is Oscar Garcia. I am 32 years old. I have been a registered nurse for the last 8 years. I have 4 years of experience in telemetry and medical surgical floors. And then I've been working for the last 4 years in the emergency department. Um, I was born in El Paso, Texas. I was raised in Ciudad Juarez, Chihuahua, Mexico. Spanish is my primary language. Um, so today I will be presenting my speech in nursing theory. So the first thing I want to discuss is how theory impacts nursing as a profession. So nursing theories are basically the backbone of the nursing profession, right? It ensures that nursing remains science driven and patient centered. They also define nursing as a professional identity. They guide practice, they influence education, and they drive research. Uh, so, by integrating theories into our daily practice, nursing continues to evolve as and as respected, as evidence-based, a profession that it has always been since the beginning of since Florence Nightingale started with the theory movement and the concepts evidence-based practice and how to provide holistic care to the patients. Um, the second point that I would like to discuss is how theory impacts nursing as a science, right? So theories, then again, they're the backbone of nursing. Theories can transform nursing into evidence-based, research-driven, and they continually evolve our practice, right? I remember back when I was in nursing school that they taught us that change it's uh, it's always, especially in the medical field, change is good, right? Sometimes we do not approach change with an open mind because we don't want to do more work, or we are so used to something that we don't want it to be changed in any specific way. But change is good, and we need to get used to change because, then again, the medical field, there's always new research coming out, new medications, new ways that we can improve patient care. So it's always something that we as nurses we need to embrace change, and the way theorists um, we can approach them by providing certain specific interventions to patients. How can we apply different scenarios um, to different theories, right? Like for example, I was working on my previous assignments. I use Dr. Kolkeva's theory of comfort, which is pretty. It's something that you can. I was thinking the other day and how the theory of comfort can you can actually put it to so many different clinical scenarios, right? To patients, for example, that I work in the emergency department, that how they come and they have so many different shift complaints. You can almost apply those concepts from Dr. Kolkeva's theory of comfort. You can apply them to a lot of different clinical scenarios. So that's something that it's very interesting. It makes your mind, it makes you start to um, think on interventions, on changes, on what can you do better, why are you doing this, where are you trying to get at the end of the way with the patients, and it's really really interesting. The third point that I would like to discuss is how theory impacts nursing as a science. So basically, nursing is an always it's a continuous it evolves as a science. Since the beginning, it's been evolving. The definition of nursing, the nurses that we've had through all these years, that they've been creating theories and going through education. They guide the science, always, uh, research, practice, um, makes us understand how to provide care, being compassionate with patients, and to contribute to scientific advancements that improve healthcare as a whole and for future generations. Um, in conclusion, nursing theories provide different perspectives and approaches to patient care, ensuring that nurses address not only physical health but also emotional, social, cultural factors by applying these theories. Nurses can deliver a more personalized, uh, best quality care to patients so they can get best outcomes. Um, so basically, that's my speech on the nursing theory and how it has helped me understand. There's so many theories. There's so many different approaches that you can take. It's really hard. I don't think it's something that you can just get a reading through and then comprehend. You really need to get into it and just try to explore yourself how you can apply different case scenarios from different patients, and you just try to apply it to a nursing theory that you're interested in, and then you can provide or you can give those uh, improvements or changes to the patient care and how you approach to patients and families and situations. And the fact that El Paso, it's such a good the fact that we live in the border between Mexico and the United States, where like it's beautiful. It's just how many cultures you see, how many languages, so how many just different ideologies and patients that you take care for. Uh, I am so blessed and happy that I have the opportunity to grow up here in this beautiful city, and I have taken care of the community, and that they allow me to keep, experiencing and learning every day. It's a learning experience. I really did enjoy this class because it makes you think. It's out of the uh, just makes your head just throw different ideas at the theories and just the way that you can apply those so you can guess patients can get the best care that they can, the best quality care as nurses that we can provide. So thank you very much. This class was really special. I felt that I have learned. It's the first step, but we'll get there. And I really enjoy the readings on the books and the theories, the different theories from the different nurses that have come throughout the years. And I'm looking forward to try and apply those some of those concepts to um, the patients that I care for, and maybe if there's something in there in between that I can improve or share, I will most definitely do so. So thank you very much, and have a good night. Bye bye.